Maryland healthcare system. And I am joined here by my colleagues, Ms. Sherry Early, who is the Chief of our Medical Administration Services, and Ms. Ashley Hanahan, who is our Toxic Exposure Screening Navigator. We appreciate everyone on the call and joining us for this veteran information session on the PACT Act and the new VA healthcare eligibility under the PACT Act. Next slide, please. So in this information session, we will be giving you a brief overview of the PACT Act. We'll discuss the new VA healthcare eligibility. We'll discuss toxic exposure screening, and at the end of the session, we'll have a Q&A session. Next slide, please. So jumping right into it, just a brief overview of the PACT Act. The PACT Act was one of the largest expansions of VA healthcare services in the past several years. It expanded VA healthcare eligibility widely across the nation. It gave the VA the ability to increase their presumptive diagnosis decision-making, which really means is that we can look at the medical history for a veteran and make a presumption that this may have come from toxic exposure, toxic exposure, which can further go and move on to screening. It bolsters our ability to do the toxic exposure screening, and the amendments in the PACT Act also allow us to have increased capacity, such as staffing, new building spaces, for us to be able to take care of our veterans, our new veterans who are being enrolled into the VA system. It also helps strengthen the VA workforce and increase our veterans benefits claim processing should they file a claim through the VBA for benefits for toxic exposure screening. Next slide, please. Okay, I'm going to be turning it over to my colleague. This is Ms. Sherry Early. She is the Chief of our Medical Administration Services here at the VA healthcare system, and she is going to be discussing our new VA healthcare eligibility criteria.
Dr. Vagela, good afternoon, everyone. So under the 2024 PACT Act, so what has changed? So under the PACT Act, all toxic exposed veterans were supposed to become eligible for VA care in increments. And those increments were supposed to last all the way up until 2032. But on March the 5th, the VA eliminated that phased-in approach, meaning that 3 of the cohorts of veterans are now eligible. Next slide, please. So veterans who participated in a toxic risk activity, which we call TARA, as defined by law while serving on active duty for training, or inactive duty training. So veterans who were assigned to a duty station, including airspace above certain locations for specific periods of time. So the first one we have is on or after August the 2nd, 1990, in the following countries: Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, or the United Arab Emirates, or on or after September 11th, 2001 in the following countries: Afghanistan, Djibouti, Egypt, Jordan, Lebanon, Syria, Yemen, Uzbekistan, or any other country determined relevant by the VA. And the VA has not determined any other country that is relevant at that time, but that does not mean that that can't change in the future. Or veterans who were deployed in support of Operation Enduring Freedom, Operation Freedom Sentinel, Operation Iraqi Freedom, Operation New Dawn, Operation Inherent Resolve, and Resolute Support Mission. Next slide, please. So what is considered a TARA? VA has determined that veterans who were exposed to one or more of the following hazards or conditions during active duty for training, or inactive duty training participated in a TARA. So any air pollutants such as burn pits, sand, dust, particulates, oil well fires or sulfur fires, chemicals such as pesticides, herbicides, depleted uranium with embedded shrapnel, contaminated water, or any occupational hazards such as asbestos, industrial solvents, leads, paints, including chemical agent resistant coating and firefighting foams, The list for radiation is here, such as nuclear weapons handling, maintenance and detonation, radioactive material, calibration and measurement sources, X-rays, nuclear weapon technicians and dental technicians who served on nuclear submarines and other nuclear ships or shipyards, and warfare agents, nerve agents, chemical and biological weapons. Now, please be aware that this is not a comprehensive list and there is no timeline. So the veterans can review additional military exposures on the link that is listed here. Next slide, please. So our Vietnam era veteran VA healthcare eligibility. So veterans who served in the following locations and time periods are also eligible to enroll. As of August the 10th, 2022, the Republic of Vietnam. And then you see the dates here. I'm just going to announce the locations, but you can see the dates that are listed here. Thailand at any U.S. or Royal Thai base. Laos, certain provinces in Cambodia, Guam or American Samoa or their territorial waters, Johnston Atoll or ship that called there between January 1st, 1972 and September 30th, 1977. Next slide, please. So what are the active duty minimum requirements for VA healthcare? In general, veterans must have served at least 24 months of continuous active duty or the full period for which they were called or ordered to active duty. So what that means is if you were called to active duty and that active duty ended after 2 months, you would still be eligible to enroll for VA healthcare. Former members of the reserves or National Guards are eligible for VA healthcare if they have a qualifying service as described above and they meet one of the healthcare eligibility requirements in the PACT Act. So former members of the reserves or National Guard who only served for training purposes may not be eligible to establish veteran status if they did not incur a qualifying disability during such training. So there are some exceptions, and we've included the website for more information if you wanted to go on that. So I just want to say that the VA websites have a lot of information listed, so we encourage you to go and look at those. So what are the exceptions to the minimum active duty service requirements for VA healthcare? The minimum active duty service requirement for VA healthcare may not apply to any of if any of these are true. The veteran was discharged or released for a qualifying reason, such as early discharge, hardship, or a medical discharge. The veteran was discharged for a disability that was caused or made worse by active duty service, and the veteran served prior to the early 1980s. So prior to the early 1980s, if you even served 1 day of active duty, you would be considered eligible to enroll for VA healthcare. And the VA encourages all veterans to apply to determine their enrollment eligibility. And please visit the website that's listed here. Next slide, please. So there are 4 easy ways for you to apply for enrollment or any veteran to apply for enrollment. So online, so we see the website here, but I'm just going to give you a little hint that if you go on Google or type in how do I enroll for VA healthcare, it can take you right to the link for the VA website. So you don't even have to remember this long website or link. You can also call the toll-free hotline, which is our Health Eligibility Center, at 1-855-976-1093. You can also mail a VA Form 1010EZ to the Health Eligibility Center at the address listed. And you can get that Form 1010EZ on the website. You can print that out and download it and fill in your information. Or you can visit either the Baltimore or the Prairie Point VA Medical Centers, and we will be more than happy to enroll you in person at either one of these facilities. Next slide, please. So why should you choose VA? So VA does provide the best and most affordable health care for veterans in America, and this is your chance to apply. Veterans who are enrolled in VA healthcare are proven to have better health outcomes than those who get their care elsewhere. And this year alone, VA has beaten non-VA hospitals in quality ratings and patient satisfaction ratings. And that's because our clinicians know veterans. They often are veterans and they know exactly how to help. VA healthcare isn't only the best option for veterans, it's often the most affordable, with copays as low as $0 for prescriptions, urgent care, outpatient care, and more for some veterans at VA. So don't wait, get the world-class care you deserve. And I just want to repeat and re-stress to you, any friends that you have, anyone you know who's a veteran who is not enrolled for VA healthcare, if you or a friend or someone you know previously applied but were found not eligible due to income, lack of service connection, or other factors, that may have changed and you may become eligible now. It won't automatically happen. You must reapply or call 1-855-976-1093 for a reassessment. So we really encourage everyone, even if you've been turned down before, told you were ineligible, let's say 10 years ago, some things may have changed. So we suggest that you reapply to see if you're now eligible. Next slide, please. And that's the end for me. Thank you very much for listening. Now
Thank
we
you,
will
Ms.
turn.
Hurley.
Okay.
Thank you. Appreciate it. I do see some hands up. We will have a Q&A after the meeting. We also see some things in the chat box that there are some technical difficulties. We do apologize for that. This session is being recorded. We did drop the slides in the presentation. And if you can hear my voice but can't see, please try logging out of the meeting and logging back in. I will also put in a plug for the VA Maryland healthcare system. We truly do offer world-class care for our veterans. The VAs are very well equipped for taking care of our veterans with the specialized training and needs in both primary care, mental health, and specialty care services. The VA Maryland healthcare system also offers 6 community-based outreach clinics throughout the state of Maryland. So we hope to see you soon. I'm now going to turn it over to Ms. Ashley Hanahan, who is our toxic exposure screening navigator. Ms. Hanahan?
Thank you, Dr. Vigala. Can you hear me?
Yes, we can.
Okay, great. Thanks. And thank you, Ms. Early, for that thorough presentation and coverage of the PACT Act. That's a perfect segue into talking about toxic exposure screening. So what is VA toxic exposure screening exactly? Well, all veterans who enrolled in VA healthcare are eligible for a brief screening that just takes 5 to 10 minutes to identify and document any potential exposures to toxins during military service. This is a screening that we offer at least every 5 years to all veterans. It occurs at all VA medical centers and clinics, including during virtual encounters. And why we're doing this screening is really in support of the PACT Act to support the long-term health care plan of the veteran and to be sure that they are receiving informed and whole health care and really moving the VA towards a model of exposure-informed care. Next slide, please. So the PACT Act, as Ms. Early discussed previously, it's really expanded not only eligibility for benefits, but also eligibility for health care. And this is really important. So veterans who may have been previously denied benefits or access to VA care, really it may be a different playing field now. And we do encourage all veterans to go through the application process. So the PACT Act did establish presumptions of service connection for more than 20 conditions, which was a huge game change with regards to some of these exposures. I won't read the whole list, but it's really expanded eligibility for benefits to a great degree. Next slide, please. So as Ms. Early discussed, what is considered a TARA, veterans who are exposed to really a multitude of toxic exposures. Some of these may be directly related to the MOS, the military occupational specialty or occupation of the veteran. Some of them are more relating to large cohorts of veterans, such as Agent Orange during the Vietnam War, and so forth. It's not a comprehensive list, as Ms. Early indicated, but there is a fantastic website here listed on this slide, which is publichealth.va.gov. I highly recommend that you share that website with anyone in your family or other veterans that you might know, because we really want to get the word out there about toxic exposures. Next slide, please. So one thing that's really changed as regards to the presumptives is the, eligibility for care, but also for service connection. And so one key important point that I want to make here is that veterans who had previously filed claims for certain conditions and were previously denied may find that they are now eligible for benefits. And so it's very important that you refile for these conditions owing to the substantive changes that have occurred as a result of the PACT Act. There's information on this slide here that indicates where you can go about finding this information on the VA website at va.gov/PACT, and the forms that you would need to refile the claim for eligibility for benefits. Next slide, please. So the next steps here to learn more in general about the PACT Act is www.va.gov/PACT. As Ms. Early indicated, there's several options to apply for VA healthcare, and here also are the links to file claims for disability compensation and some very specific information with regards to the registry examinations. Next slide, please. All right, thank you very much.
Thank you, Ms. Hanahan. So that is the end of our presentation. We will now open it up for our Q&A session. I do have my colleagues here and subject matter experts from across the VA Maryland healthcare system, from primary care, women's health, social work, mental health, as well, to join me. And I do see a hand up. Give me 1 second. Okay. Michaela Restituo. I apologize if I didn't pronounce your name correctly. Do you have a question for us?
Okay, if you question in the chat or send it to our email, we're asking that the questions are put in the chat.
All right, I will look in the chat. Okay, yes, I see that you're, thank you for putting in the chat that your mic is disabled. If you're able to put your questions in the chat.
Dr. Vigela, if you could share the email address we also provided for those who are on the phone and may not be able to use the chat, they can send their question via email.
Absolutely. Okay, I am seeing, let's see. Michaela Restituo is asking, the invite said we can set up a one-to-one appointment. How would Michaela Restituo go about setting up a one-to-one appointment? And I assume you mean with enrollment?
It looks like Ming had set a response there with the 855 number.
Got it. Thank you. So yes, you can speak with someone directly right now by calling 855-976-1093, and that is in the chat box. Yep. And you can go ahead and we see again what the email stated. Please go ahead and call 855-976-1093, and we will help you set up that face-to-face appointment.
Dr. Vigala, do you see the question from Amanda Benjamin?
I must have missed it. Yep, I see it now, just came through. So Amanda Benjamin is assisting a client with his claim and wanted to know if the PACT Act information is under the normal disability claim or if it is its own separate form or document.
Yeah,
Dr.
good
Vicky-
afternoon. Can I jump in here? Jerry Taylor with the Maryland Department of Veterans and Military Families. Regarding the disability claims, yeah, it's the same as any other disability claim as the package indicated. If the claim has never been filed in the past, you would use the original claim form 21526EZ. If the condition had been filed in the past and been denied, it would be a supplemental claim using a 20-0995.
Thank you, sir, very much. Next question is how do I file/test for a chemical exposure not in the areas listed? Ms. Hanahan, are you able to help answer that?
Sure, Dr. Vigala. So if you are enrolled for VA healthcare, a primary care provider or another provider within the organization can refer you to the environmental registry clinic. We can review any and all exposures, and then we can also assist you with any information you need to regards to filing a claim.
Thank you, Ms. Hanahan. And we are asking another question. Do we know how a veteran can obtain his or her medical records before they set up an appointment? And can they set up an appointment before they have the physical records? Apologies.
So for that question, I guess that's going to be dependent upon what type of records. If you're talking about military records, those records will be requested through the Veterans Benefit Administration. If you're talking about the medical records that we have on file at the VA Maryland Healthcare System or within a VA healthcare facility, you can actually come into the facility and put in a release of information request for those records. You don't have to have those records prior to applying for a disability. If you're already in the system, you can apply for that disability, and obtaining the records is going to be part of that process.
And Ms. Early, does that apply to the military records as well?
For the military, yeah. So I believe for the military records, if someone is already getting VBA assistance, they should have access to those records. But I will let someone on from, is there anyone on from VBA who might be able to answer that better?
VBA is not here, but Jerry may be able to answer that.
Can you repeat the question?
Jerry, we're being asked how can a veteran obtain their military records?
Well, if the records are already part of the VA claim, if they filed a claim in the past, then VA would have those records. Otherwise, you would have to go to the National Archives. However, we would recommend that you do not wait to get those military records to start your claim, because VA will request those records on your behalf. So there's really no need to wait until those records are in your hand to start the process.
Thank you. So what I heard is even if you don't have all the records, please go ahead and give us a call. And if you need to, please go ahead and start your claim as well. I did drop the email into the chat box. If anyone would like to submit questions, it's VAMHCS Public Relations, all one word, at va.gov. I see a next question here. What do you do if you're already 100%, I assume service connected, but have some conditions that come up because of the PACT Act?
Yes, sorry to monopolize, but I'm going to take that again.
Please go ahead.
Yeah, you should file a claim for any service-connected condition that should be recognized even if you're already 100%, if it's a separate condition not related to your other conditions, you should file for that. It may or may not result in any additional monthly compensation, but nevertheless, any service-connected disability should be recognized.
Thank you. Our next question, there's two parts to this question, so I'll read the first part. Does changing address or relocating change eligibility? Ms. Early, are you able to answer that?
Yes, I am. So changing your address or relocating does not change your eligibility. Thank goodness that the VA has a very good electronic health records. So anywhere you're seen in the United States at a VA facility, they're able to see any information that is in the system. So if you moved from here to California, California can pull up your records from here and they can see everything. And the next part of your question is, how sensitive are addresses? Do veterans have autonomy? So anything in the VA health record is sensitive. So you don't have to worry about that.
Okay. And I do see some answers. Was asked again, do you need the military records before making an appointment? And Ms. Hanahan answered, you do not need military records before making an appointment with the VA. Okay. Please let me know if there are any questions coming in through email or if there are any questions that I missed in the chat box.
No questions through email at this point, but I am continuing to keep an eye on it.
Ms. Hanahan, could you tell us how someone can schedule an appointment for screening, toxic exposure screening?
Certainly. So if a veteran is already enrolled in healthcare, they can pursue the toxic exposure screening with their primary care provider. As mentioned before, it's a simple questionnaire. But if anyone also has questions in general about the registry process and is already enrolled for healthcare, I'm happy to take those questions, and I will type my contact phone number in the chat.
We did also through email get a request to have the PowerPoint slides sent to someone, so I definitely will do that. And if anyone else wants me to do that, certainly you can just send us an email at VAMHCS Public Relations at va.gov.
So I do see a question. High blood pressure was listed as primary. Does other symptoms qualify as secondary?
I'll address that as far as the compensation is concerned. Hypertension is presumptive for exposure. If you're service connected for hypertension and there's other conditions related to that, you can claim them as a secondary condition to that service connected condition, but you're going to need medical evidence connecting the two.
Thank you, Mr. Taylor. And we do have a request in the chat box requesting slides. Again, the number to call to enroll or have a face-to-face appointment, I'm dropping it again in the chat box, is 855-976-1093. And questions can be emailed to VAMHCS Public Relations at va.gov. Okay, I'll just do a check. Any other questions coming in through the email? All right, I do see a couple coming in through the chat box. For Ms. Ashley, you're being specifically requested, Toxic Exposure Navigator. Does this include those still serving and due to retire at the end of the year?
The toxic exposure screening currently is for those already in a veteran status. And so it sounds like though you might be transitioning out, so it shouldn't be too long before you would be eligible for that. Some of this should occur at the end when you get your separation health assessment or at the end of your time in service, but you're welcome to contact me to discuss further if you would like.
Then our next question, at my doctor appointment, I was asked about my past toxic exposure. Do I have to make an additional appointment regarding the exposure?
So an additional appointment is not necessary. However, if you would like to be enrolled in one of the registries or have a exposure type examination, that can certainly be arranged, and you're welcome to call me at the phone number listed above in the chat, but that's 410-605-7000 and the extension is 57671. I do just need to mention that in order to have these assessments or be in the registry, you would need to be enrolled for healthcare. And so if you're not enrolled, please do so.
Okay. And then somebody is asking, does VAMX public relations at va.gov, is this for all states of the US to ask questions? So anybody here on this call can send a question to that email. Those do come to specifically to the VA Maryland healthcare system, if that's the question being asked. The next question is, are side effects from treatment for service-connected conditions like cancer treatment that have unexpected consequences covered? I do not believe that is part of the toxic exposure screening, but I will let Ms. Hanahan confirm that.
Yeah, and I think this question relates to something Mr. Taylor answered earlier, which is that you can file claims for conditions that are secondary to presumptive conditions. For example, as indicated here, side effects from cancer treatments, for example, like neuropathy, which sometimes is a complication of cancer treatments. And so with regards to eligibility for benefits, you can file a claim, but medical evidence would be needed to support that claim.
Right, and just to expand on that a little bit, we have to differentiate between side effects and actual chronic conditions. So if they're like the example you provided there, that's a that's a secondary condition as a result of a primary service connected condition. So yes, that case, yes. But if we're talking about side effects, it would have to raise to the level of being a chronic disability.
Yeah, thank you for that clarification, Mr. Taylor. Correct.
Okay, and we have another question coming up. I was denied for PACT disability, but in the same, I did qualify for PACT Act. Should I file again under supplemental?
Okay, yeah, there's a little misunderstanding. We have veterans coming to us saying they want to file for PACT Act. The fact that you would qualify as presumptive for exposure, that's not the basis of the claim. The claim would be the disabilities as a result of the exposure. So if you have a service-connected disability that was denied in the past but is presumptive under exposure under this PACT Act, absolutely you should file a supplemental claim for that. At the end, we'll provide some information where you can contact our agency and we can provide assistance with that.
Thank you for that, Mr. Taylor. Okay, just giving it a minute, but not seeing any other questions come up quite yet. Do we have any questions coming in through email?
No more questions through email.
Okay, I do see another question in the chat box. How do you submit medical images for claim that were old radiographic images that can only be viewed by light boards?
Well, we do submit those to VA, and it basically would be they would make copies of those. But they are submitted through the VA mailroom. What you're hoping in cases like that there's reports to accompany those images that would serve as a more relevant evidence than the images themselves. But yeah, they are submitted as supporting evidence for the claim.
Okay, not seeing any other additional questions in the chat box. I'll just give it a minute.
No more through email either.
Okay. And then I do see Mr. Joseph Carlucci. No company can be found. I've tried several commercial imaging locations, but no longer have the capability. Mr. Carlucci, again, if you want to try submitting the images themselves with your claim, and if not, if you have the report, that would work as well. Okay, and I see Mr. Taylor has put in his contact information, Maryland Department of Veteran and Military Families, phone number 410-230-4444. And Mr. Khan has put in the chat box, I'm assuming this is on based on Mr. Carlucci's question about the VA images, that VA Access has options. Okay, just giving it a minute to see if we have any more questions come up in the chat box. But hopefully you see our information that is there on your screen. Not seeing anything else pop up. I want to thank all of our veterans for joining. I want to thank my colleagues from all over the VA Maryland healthcare system for joining. I would like to thank Ms. Early and Ms. Hanahan and our public affairs team. And I hope everyone has a great rest of your day.
Thank you.